Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey, Tuesday night can mean only one thing, Health Chat. I'm Dr. Nick Circolone. Sit back, relax, grab a cup of coffee, enjoy the show. I'm just hanging out, relaxing, taking it easy. It is my Friday today, Joe. My Friday.
Your Friday?
My Friday.
How'd you work that out?
Well, it's one of those things where my office manager took off, and I said, you know what? I'm going to take some time off and sit back, watch some Netflix and little Hulu, and I'll be working on the deck, actually.
That's usually how it works.
Yeah, it's one of those things where I looked at the deck and I go, I got to get this done. So you call somebody and they don't come, and it's like, okay, I'll just do it myself. Dr. Dooley used to be he was my friend and business partner for 17 years before he passed away. And way back when, I was thinking about putting a railing system, a new railing system on my deck, and he goes, don't hire somebody. You need a project. Why don't you do it yourself? And I was like, okay. So $1,600 in tools, and 3 months later, it was done. So I got all the tools now.
But you saved a lot of money.
Yeah, I did. And I was looking. Materials are coming down a little bit, not much, but they're coming down a little bit. So I decided, you know what? I'm going to take some time off. I'm going to redo part of my deck and change some things around, and I'm going to use perfect form when I lift,
sure,
and bend, and
yeah,
right, whatever. So I tell people that everybody goes, I was just squatting when I was lifting, and yeah, okay, sure. We never do that, and we always hurt ourselves, and something happens. We were talking last week, Joe, about being an advocate for your health care, being an advocate to take care of things. Today we're going to talk more about that, but I want to talk about the Dirty Dozen and the Clean 15. Everybody goes, what the heck is he talking about, the Dirty Dozen, the Clean 15? Well, what it is, we're going to be talking about foods that have so much pesticides in them that we consume, and it just so happens that the ones that we do consume and that we really like are the worst.
Really?
For that, yeah, and we'll talk a little bit about that. I want to give a shout-out to my Facebook family, and guess what? We're actually live on LinkedIn. I tried that.
Nice.
So we're supposedly live on LinkedIn. I don't know if we are, but if you're out there, just give us a call here at 267-1023. You can always get me at the office, 423-855-7376. Except for this week, I'll be on the deck, so I'm not going to answer my phone while I'm on a ladder, just doing all of that stuff. But I'll tell you, we talked last week about how eating dinner with family was so important, how we wanted to make sure that when we're together, when we're mingling and we're commingling and we're doing things together, not only is it good to be with the family, but you know what? It really helps with depression and anxiety. Think about that. I mean, for two years, basically, we were locked in, couldn't go anywhere, couldn't fellowship, couldn't do the things that we normally do, and then we're just starting to get out of that somewhat. And I think we are so depressed with anxiety because we were just basically stuck somewhere without, any help. And I think our diets really suffered because of that. Not only did our diets suffer, but in our mental, anxiety, our stress, and we're not talking to our doctors about it. And doctors really don't know how to deal with it at that point. They're like, here, take this, take that.
Yeah, I can fix your body part, but I don't really know what to do with other stuff.
With your brain. And, and this is going to sound so bad, but when you're try to be an advocate for your health care, a lot of times you get shot down by the people that you think are closest to you. I'm going to say this. It's going to sound really bad, but listen to what I'm saying. Christians seem to eat their young when it comes to mental health. If you don't, they'll pray for you. If, you're in a car accident, they'll pray for you if you have cancer. But when it comes to mental health, it's really hard for people to pray for that. They don't realize that it's an actual thing that people are dealing with is with mental health. And one of the ways that we could be advocates for our health care is that we eat the right foods. Now, I said there's the Dirty Dozen, and then there's the Clean 15. The Dirty Dozen, can you think of one food that you would think, and it's a vegetable, let's talk about vegetables and fruits, that are in the Dirty Dozen that you would think people would really, really like to eat and probably eat a lot of?
Tomato.
Very good. That's one of them. Kale is another. Kale, mustard seed, collard greens and mustard greens. They're really high in pesticides. I had written it down, or wrote it down, whatever you want to say, that a lot of times these pesticides that are in there, there's more than 19 of them in this Dirty Dozen, which is crazy. But the worst is strawberries and kale for these pesticides.
And I guess they just, the pesticides seep into it, so just washing it off really doesn't get it all.
And they when you look at the research is saying that don't wash your vegetables with a vegetable wash. Clean them, rinse them, make sure that you get all the stuff off, and use a little brush to clean them off and just kind of wipe them down, and that would help decrease a lot of that. But here's the kicker. Even with your Clean 15, now guess for one that you would think would be a Clean 15. Just a vegetable or fruit. What do you think would be a Clean 15?
Potato.
No. Potatoes, well, yeah, actually potatoes are in there, but that's not one of the 15. But believe it or not, avocados are.
Really?
Avocados have very little, if any, pesticides in them, which is kind of cool. It's like, that Clean 15. I like avocados, and some people just don't like that. Mangoes, watermelon, they're in that Clean 15. So, but like bell peppers, the kale that we talked about, the tomatoes, the strawberries, the grapes, all of them, and peaches,
it's
all
a
of them.
Porous surface.
Yeah, and they just have the worst pesticides. But and here's what's really funny. And I didn't think about this until I was like reading through this and doing some research. But what do you think, okay, what do you think is another problem with fruits and vegetables and food that's out? So I know we're right on a break, aren't we?
Yes.
So we're going to take a quick break. We're going to come back. Think about that. If you have any questions or you have an answer, or if you want to ask one of those, give us a call here, 267-1023. And I will be back. You're listening to Health Chat. I'm Dr. Nick Circolone. Take us out. I'm Dr. Nick Circolone. You're listening to Health Chat. Hanging out, relaxing, taking it easy, not eating any of the Dirty Dozen right now. I love the Dirty Dozen. I mean, I love the stuff that's on that list.
I love strawberries.
Yeah, and celery's on there. And
I could do without that.
Yeah, well, some people are like, I don't like celery. People put peanut butter on it or cream cheese, and they eat it that way. But here's what's really interesting: when you look at some of these foods, you're like, they're the most readily available that you can get, and they're easy because a lot of people like them, but they're really hard, or bugs get really get into them. And there's definitely something. It's crazy that how many pesticides are in them. But what's interesting is the Clean 15, and sweet potatoes are on that the Clean 15.
Okay.
Believe it or not, I thought that was pretty interesting. But they have every one on the Clean 15 is 75% pesticide free. Avocados, like almost 100%. So
at what point are we okay with eating? I mean, what percentage? Because 75% doesn't sound too good to me.
Well, it's probably easier to wash off at that point.
Okay.
Then they're there. They use less than 15 or 25 different pesticides, but they're cleaner because they're using very little, if any, on there.
Okay.
They might go on there from another crop and things like that. So they're cleaner. But here's what's interesting about this, and I never thought about it. I mean, you don't think about these things, but what is kind of not the worst, but what do you think is a problem with the fruits and vegetables that are out? What do you think would be a problem with them? Take a stab.
Other than the pesticides?
Oh, other than the pesticides. Forget if there was no pesticides involved, what else would be like detrimental to us and our health?
I guess just them staying fresh.
Bacteria.
Bacteria.
People picking them up, smelling them, rubbing on them, sniffing them, squeezing them. Think about that. How many times you go into the supermarket and see people picking up stuff, touching them, putting them down,
Put it back down.
or they go. My biggest pet peeve is they get a bag, they lick their fingers, and then they start picking on the fruit. You're like,
I
oh,
think that drives you crazy.
it drives me nuts. Or somebody's want to count money and giving me money. And stop doing it. I do not want you. This is before COVID, and I'm not a germaphobe. It's just like, that's disgusting. Why don't you just spit on the fruit for me? You know, it's like, come on, cut me a break. But, yeah, I'm going to wash them. I'm going to wash my hands before I go home. How many times do you wash your hands after you do something? Whether you pump gas, go to the grocery store, touch these microphones,
Me?
Yeah.
Probably not enough for you.
Well, I'm not a germaphobe. I'm just like, I don't want to get that stuff.
Well, after you come out of the restroom, sure, you do it then.
Oh, that's when I don't do it.
Oh, great.
I'm kidding. I'm just kidding.
I'll shake your hand after we're done.
That's right. Well, I'm a face toucher. Like sometimes I'll touch my face, and or if I have glasses on, I'll touch my glasses. I can't tell you how many times when people were wearing masks, how many times they touch their face with their hands.
Yeah.
And I did that a lot because they're uncomfortable. So I wash my hands all the time. And everybody uses, this is kind of a little off the beaten track for a little bit before we get into this, but this is really part of your health care. You don't want to be sick, but you want to wash your hands. Like everybody uses this germicide that's here. I just pointed to something, and people are on the radio like, what do you just point at? People on Facebook saw me do it. But when you use this, the Germ-X and things like that, you're killing all the bacteria on your hands, right? So if you keep using that without washing it off, that's kind of disgusting too.
I will say that COVID, I guess if there's one thing that, for me anyway, that came, one thing good that came out of it is the fact that I do wash my hands more.
Oh, yeah.
Obviously, you want to, make sure you stay COVID-free. And not that that in itself is going to prevent it, but, I mean, it
does help.
It did make me become more aware
Yeah,
of it.
it does. And I wash my hands all the time because I'm with patients.
Yeah.
So I'm always washing my hands. But when I use like germicide and things like that, I use it maybe 2, maybe 3 times, and then I wash my hands. Get that stuff off of there. And I try not to use bacterial soap when I do it. Or antibacterial soap, antibacterial soap, because you want to just wash it off. You don't want to kill everything that's on you, because literally you need bacteria on your skin to help protect you. There is special bacteria that's on your skin that you need it to be there. You don't want to wash all of that off and kill all that, because then that leads to other problems. So, you have to be careful about what you use to wash your hands. It's not harsh and things like that. But, we were going to talk about being a patient advocate, okay? And being your patient advocate, like having family members that have been sick, you become an advocate for them. You really do. The best example of an advocate that I have ever seen, I've seen a lot, but in my family, my sister-in-law was awesome. I mean, incredible. When my brother was sick, she knew everything. And it was funny because Stephen, he said when he found out that he had pancreatic cancer, he looked at her and he says, "Your job is to make sure everything's right. My job is to get better." And I mean, she researched. And if you've ever had somebody that's had cancer or had a debilitating illness, there's it's called Caring Bridge. And she wrote on Caring Bridge, I mean, like novels on Caring Bridge. I have a book at home from everything that she wrote from Caring Bridge. She actually had it printed. I am not joking you. It's 3 inches thick.
Wow.
Of all the stuff that Stephen went through and how he went through it, and, before he passed. And that's a whole nother show. I need to talk about that story about, even miracles happened with all of that. But, Stephen eventually had passed away, but she was such an advocate for that, which gave me this kind of thought like, okay, if you're an advocate for someone else, why aren't we being advocates for ourselves? I've seen more and more, and I don't know why this is, more and more doctors are either dismissing or saying that they can deal with something that they normally don't deal with. We were talking about mental health earlier. A lot of doctors don't know how to refer to mental health. They don't, because every single therapist is different. So there's no consistency for them. And I think it's very hard for them to go, I think this one's okay. Let's send you here. Same with chiropractic. I mean, you look at the chiropractors and you look at all the stuff that's out there, the Earl Scheib chiropractors, I call them, and the guys that are trying to sell you condos. Why would you want to send a patient there and get somebody to come back and go, why did you send me there? That was ridiculous.
Yeah, it's not like they don't want to help, but if they don't know, then they don't know.
They don't know. But what they're seeing is the inconsistencies in some professions, so that's why they don't refer. It's easier to refer to PT because they know exactly what PT is doing rather than referring to chiropractor. Use that as an example, okay? It's easier to refer to a psychiatrist than it is to a counselor because they understand, hey, we're MDs, we're DOs, we're psych. You're gonna, I don't know what you're doing over there, we work on the body and you work on the brain. So I don't know what it is, but you're a doctor, so I'm sending you over there. And they understand that. They understand how that works. But sometimes you have to be an advocate for yourself. Now, I'll give you a good example. I had a patient come in and they were struggling with weight. I mean, literally struggling with weight. And they said to their doctor, would you please give me a referral to an endocrinologist? And the doctor was like, you don't need to see an endocrinologist. What do you mean I don't need to see an endocrinologist? I'll take care of that. We'll check your blood, and I'll take care of all of that. Okay, but if I'm requesting to see an endocrinologist, I'm asking you to make that referral for me. So as my healthcare provider, I expect you to do that. Well, it really upset this patient. They were like, why wouldn't they send me there? And they were so adamant about wanting to see an endocrinologist. And finally, they got into an endocrinologist because I'm going to tell you a little secret. Not everybody needs to be referred to a specialist. You could just go. A lot of insurances now, there's very little HMOs. You can go. You can open the door and say, here I am. I need you to help me. You can go. Now, PT is like I think they're a little more open access now. I know I'm open access. Your specialists are open access. Sometimes it's easier when you have a referral because they'll get you in faster, but you can still do that. And I'm that way with what I do. If as a patient, if I feel something's not right and I want to do something, I'll make sure that my doctor, because I pick doctors that they're going to listen to what I say, that I want to do this. But when I have a patient come in, let's say you came in the office, Joe, and you were complaining of low back pain. And I said, well, let's look at this. Let's go for it. And you looked at me and went, Doc, are you not going to do an x-ray? And I go, well, not necessarily do we have to do an x-ray right now. If you don't respond within this small amount of time, which is 1 to 2 visits, then we're going to do an x-ray. We're probably going to end up doing an MRI too. Oh, okay. But to say we're not going to do that, and I've had patients literally, the doctor said, you don't really need that. And I'm like, if you want it for peace of mind.
Sure.
And one of the things that I find that, again, being a patient advocate or being your own patient advocate is I'm going to tell people a little secret, and the guys are, my doctor colleagues are going to go, would you shut up? We have secrets, man. When you get tests done, it doesn't take 4 weeks to get results. I literally can have results from an MRI within 24 hours.
But we don't get calls until...
You don't. Now, a lot of that is they're busy, their staff's busy, they're understaffed, it's hard to get through. There's reasons for it. I do get that. Don't I'm not saying that they're doing it on purpose. It's just it's very hard to juggle some of that stuff. But let me tell you something. If you are going to call me, like I send you for an MRI. If I'm sending you for an MRI, you're going and you're like, something may be wrong here. And I'm waiting 4 weeks. So what are you doing? You're thinking about, okay, how bad is this possibly? What do I have? It's so bad they're not calling me. What's going?
Mental
and your
stress.
mind just keeps rolling. So I try my best to do this. If I do an MRI or an advanced test, I try to call that patient. If I do it like on a Thursday, and I can get the results Friday, I'm calling before the weekend, the following week, because they're going to be stressing about it all weekend, and I want to make sure that we're good, everything's good. There's some things I found on there, not serious, but we'll talk about them when you come in. But everything looks pretty good, easily working around, and that's just a peace of mind. But a lot of times the patients cannot be advocates. I have a patient right now, and I feel so bad about this. They came into the office. We did some therapy on them. It were manipulative therapies. They were responding very slowly. So we ended up sending them for injections. The injections didn't work. And I'm like, okay, we really need to get a surgeon on this one. And I probably mentioned this before. So I sent them to a surgeon, and they're calling me going, they're not calling me. They're not, and I'm saying, they're telling me 4 weeks out. 4 weeks out? For 4 weeks, and you're in tremendous amounts of pain. So you can't force somebody to see you. And it's like, I don't want to send you somewhere where your outcome is going to be poor. I want to send you somewhere your outcome is going to be good. And this is where I recommend. If you go somewhere else, I didn't recommend that. I'm telling you where I'm recommending you to go. So it's important that, you know, you communicate with the doctor, but sometimes we can't do anything. Our hands are tied with some of that stuff. So, yes, there are times when you can make and say, hey, listen, I need something done. Please have this done. And we could do that. And there's times when we can't force the issue. I mean, I can't force a referral if they don't have the room for you.
Well, I think the big three in my eyes is, as far as mental stress, the origins of mental stress: money, relationships, and health. And, you know, anything you can do to de-stress over those situations is a great thing. So when you do go to a doctor and you have an MRI or whatever it may be, and you're just worried to death, and I've been there, you're worried to death about it, you know, whether it's over a weekend or 3-4 days, a week, whatever it may be, you know, that stresses you out. That really does, because that takes up most of your thought process.
Well, you know, I will give a plug out. I'm going to give a plug out. Prime Imaging is very good about talking to a patient while they're there. You know, they don't go overboard, but they go like, we're going to do this. They explain everything to the patient. And that's why we like them, because they do that. And I understand that, you know, they're busy, but they have the time, and their patient care is pretty good.
Good.
You know, for an imaging type center. And they do a lot of stuff over there, but that's one of them. And I like the fact that when a doctor calls me and kind of we have a conversation about that, we have a consultation. And it's kind of nice to know, or I'll call their family doctor and say, listen, I'm going to do this, and this. And not only does the patient appreciate that, but the doctor does. It's like, oh, okay, I got that. I see where you're going with that. That's great. And you know, let's say, can you a ball cart? You know, you take care of that. We're going to come back. We're going to come back. Give us a call here at 267-1023. And I'm telling you, the phone lines are open. You have any questions? If you've ever been in a situation where you needed to be your own patient advocate, we want to hear that. So give us a call here, 267-1023. You're listening to Health Chat. I'm Dr. Nick Circolone, and we'll be back. We're back. Talk Radio 102.3. I'm Dr. Nick Circolone, hanging out with Cowboy Joe, relaxing, taking it easy, and just kind of
Well, it's your Friday. You can do that.
I know. You know, it feels good. We moved from Thursday to Tuesday, and Thursday was like my Friday, and like it's like now it's not really my Friday. So, but it's been fun. We got Ed on the line, Edward on the line. Edward, how are we doing today?
Hey, Dr. Nick, how you getting along?
I'm doing fantastic, my friend.
Hey, well, you stirred up a hornet's nest in my car.
Uh-oh.
You know, I'm having a problem with people accepting my insurance. I'm 70 years old, and it seems like none of the doctors want to accept Medicaid and Medicare anymore. It's very difficult to get, as you would say, a qualified doctor, not just a doctor, somebody who is going to listen to your problem and get you the proper diagnosis so that you feel at ease. And I'm right now I'm under a lot of stress because neuropathy is basically taking over my hands. I have type 1 diabetes. I'm on an insulin pump, and you know, this right here, this situation is not going to get any better because I've had diabetes since I was 27. So I've dealt with diabetes on a serious level, but I just think that the customer service that's being done to the older people seems to be deteriorating. What do you think about that?
Well, you know, Edward, it's such a catch-22, to be honest with you. You know, as we age, as we get up there, you know, I'm 60, so I'm not like really far behind that. But what's interesting about it is that a lot of doctors aren't taking Medicare because Medicare doesn't want, number one, to pay. The reimbursements are terrible. But not only that is that we have to jump through certain hoops with Medicare that takes a lot of time, a lot of effort, and a lot of resources, which we lose money doing that. In a lot of places that are larger places where doctors are, they don't take that because of those reasons. So that's why a lot of your Medicare or Medicaid, they're going into hospital doctors and being able to be treated there more so than like a family doctor that's separate from the hospital. Like I know Erlanger and Memorial, they have their own doctors that are there that should be taking your insurance. But again, they're going to be overflowed with patients. It's going to be hard to get in there, and they're going to try their best to give you the care that you need. But you're right. It's really because they cannot make ends meet by seeing just that clientele, or excuse me, that patient base, because of the reimbursements. They still have to have lights on. They still have to pay staff. I know that's not an excuse, Edward, and I don't want it to be. I'm just saying.
Well, it seems to be a catch-22 because first of all, you took an oath to help people who are ill, and now it seems that the oath and money is wrestling with each other, and you're still practicing, but you're not scoring any points by communicating that what you just told me would have validated a lot of visits that I've had with doctors who have got out of the network and basically formed a group. You know, it just seems to not work out the way that people thought that it would.
No, and you're absolutely correct. And I'm just going to give you just another caveat. What you're experiencing right now, Edward, is what they want to come down the pike with this one-payer system. It would be worse, believe it or not, than what you're going through now, because you wouldn't have, and there are doctors that are trying to kind of overcome a lot of that stuff and trying to help the patients. One thing, and Joe and I were just talking about that, weren't we, Joe?
Yeah.
Customer service in the healthcare industry is not where it should be.
No, there's no customer service when it comes to healthcare, Doc. If you want to be 100 about what's going on, because they're trying to get you in and out, it's like a revolving door. And so the service that you do, you leave out the door with more questions than you do answers.
No, and I agree with you. I wish there was something we can do to kind of fix that. But I will tell you this. It's very rare that a doctor is just in it, and I've said this before, just for money. We didn't get in it for that. Sometimes we get like caught up into this wave that we have to do that. Now, a lot of doctors in the past 10 years have gone from private practice into group practices in the hospitals because of the extensive overhead, the staffing. I'll give you a real quick, I know this isn't, again, it's not an excuse, but I'm just going to tell you this. But I know a doctor, we were just talking about this not too long ago. They had to shut down one of their offices, actually two of their offices, because of staffing. And one of the office that he is practicing in right now, the longest standing employee is 12 months.
Yeah.
Wow.
So,
yeah.
I mean, now I have to say, in my office, I've been lucky.
Nobody wants to work anymore.
No, Edward, they don't. We're in a heap of trouble with some stuff. But I appreciate your call.
Thank you for taking my call.
Oh, anytime, Edward.
You just stirred up. Like you say, I just happened to have been experiencing this situation now. I've had a pain in my left side for about 3 years now, and I've had an MRI. I've had a CAT scan. I've had basically everything that I could imagine, but I'm still hurting, and nobody can seem to tell me why I'm hurting.
And that's a hard thing, and it might be one of the doctors that you need to see, maybe a different type of doctor, like not your endocrinologist, but maybe a gastroenterologist, something that you can't see on an MRI or you can't see on the X-rays, and they have to go in there and scope and do things like that to find things. So it's
well, Dr. Nick, what you're talking about is the same thing I just told my gastro doctor. You've been in my mouth and you've been up my rectum, and you should have been able to tell me something to satisfy this pain in my chest.
Yeah, that could be a whole myriad of things, Edward. And it's I wish I could diagnose people over the phone. That would be kind of good, don't you think?
That would be great. I would be first in line. But I thank you for letting me vent.
Oh, listen.
And the conversation was very interesting. I just happened to turn the radio on. I listen to talk radio and the sports guys all the time. So thank you for taking my call.
You are so welcome, Edward. Listen, God bless you. You have a great day now.
There you go. But he's echoing thoughts that a lot of guys and gals out there have.
It's so, when I was thinking about doing this, I was like, I don't know if people are going to be interested in this, but it's important to hear it from a medical provider that I do understand this. I do hear this. And I don't know if I mentioned this. I talk about a lot of things, when I do YouTube and when we do, some of the other things on Facebook. One of the things that I got a letter from Medicare, Joe, all right? And Medicare says, Doctor, you see more Medicare patients than other doctors in your field. Like, okay, are you bean counting? And then they say, this is not an audit. We just want to inform you that you are above the national average of seeing these patients. And I'm like, yeah, right. You're going to come down in my place and get all up inside because you don't like that I'm seeing more patients than anyone else. And the reason being is because nobody else is doing it.
Nobody else wants to.
Exactly. I see them because I want to see them. I want to help them. But now you're telling me, so you're forcing me. So whenever it was on the line, I wanted to let him know that it's like sometimes Medicare forces us to do things and to get out of taking Medicare because they are being so, or the insurance companies in general, they're being so stringent with stupid things. Like I think I told you, actually I did one of my YouTubes, and if anybody's interested in going on seeing our YouTube channel, we would love you to subscribe, hit that notification button, show others. You'll see some of our shows on YouTube as well as some other things that I do. But one of the things that I did talk about was patients, certain insurance companies, I think we talked about this last week, certain insurance companies make you jump through hoops regardless of the symptoms. Like, well, this is this problem. We're not going to do advanced testing until you do this, and this for 6 weeks. I'm like, are you kidding me? You're waiting too long for stuff. So the insurance companies now are dictating. And it's not doctors doing it. It's the insurance companies, and people that are doing it aren't doctors. They're either nurse practitioners or not even nurse practitioners. They're just nurses, or people going, no, I'm reading a script going, no, I don't think you should have this. So,
I'm somewhat of a younger guy. Going back to Edward's thoughts of customer service and time that you're actually with a doctor. I'm somewhat younger than Edward. So health wise, I personally like to go in. All right, doc. Check my heartbeat to make sure I'm okay, and then I'm out, and I'm okay with that. But as I get older, I realize that there's going to be more things pop up. I'm going to need to spend a little more time with my primary care physician or whoever it may be, my specialist. And I'm lucky enough to have one of those that's really good. And from what I understand, the other guy's really good too. But like I said, I haven't had to spend much time. But that's invaluable for a lot of people because they just want someone to talk to, and they say, "Hey, can you help? I just want some help."
Were you reading the script? Because you opened the door for that, Joe. We were talking about, like, I'm a firm believer in your blood's going to tell you a lot. And you've heard my new commercial where we're talking about that. We're doing advanced blood testing, and we're doing urinalysis, hair analysis, and we're finding out what's going on. We're doing a little bit more than the others. But it's a cash-only thing because insurance companies are not going to cover it. They don't want to pay. They don't want you to get well. I shouldn't say that, but it seems sometimes it's like, do they really want you to get well? Here, keep taking all of this medicine. And, I got patients that are taking 5, 6, 7, 8, 9, 10, 12 medications. I'm like, really? No wonder you're feeling bad.
Mm-hmm.
I would feel bad if I took all of that stuff. So what we're trying to do is we're trying to get somewhere where we can help deal with some of that. And we'll talk a little bit more about that at the break. Give us a call here at 267-1023. I'm Dr. Nick Circolone. You're listening to Health Chat. Phone lines are open, and we will be back. We're back. I'm Dr. Nick Circolone, and you're listening to Health Chat. We are coming up on the top of the hour. Joe, I always said it when Julie was with me, like, we could do 2-3 hours.
Every Tuesday.
And she would always go, Nick Circolone. I miss her. I keep saying that. I miss her. If she's ever listening, I hope she calls one time and says, oh, But, yeah, she was awesome. Well, we have John on the line. What's going on, John?
Not too much, but I agree with Edward. It's one of those things. I called in a couple of weeks or 3 or so weeks ago, and you prayed for me.
Yes, I do remember. We talked about that today, as a matter of fact, John. I do remember you.
Okay. Well, I don't have any issues with my kidney, but I do need to get that checked out. But I'm not, like I said, I'm not feeling any issues with it. And I've applied for disability, and I've been turned down twice. But I keep going. They keep sending me to the doctor, and to make a long story short, they don't seem to think I'm disabled. So I'm sorry.
I said that's interesting. That it's disability is so hard, John, for people to get on. I mean, some people get on it and there's nothing really wrong, and then there's other people that really, really need to have disability and they can't get it.
I mean, I can't walk. But anyway, to make a long story short, I'm going through the process again. But my back hurts. I can't walk. And, to make a long story, make a long story short, I am disabled. My wife says, you shuffle around, I'm 58, and you shuffle around like you're 80.
One of the things is, and I'll be honest with you, when you have an attorney that helps with your disability, that's probably the best thing, because those are the guys that know how to do that. I mean, I wish it could be a lot easier, but sometimes you need an expert to help you with that, John. I don't know if you have one, but you may want to. Yeah, I mean, they work hard for that, but they're disability attorneys, and that's what they do. It's like that's their specialty. And I know a lot of people that have tried, and I don't want an attorney, and then they have to get an attorney, and sure enough, that's the only way that they get taken care of, unfortunately.
Well, that's where I'm going, because I called them yesterday, and they said we'll go to court.
Wow.
Yeah.
They see me walk in, and I can't. They say, I see you. What you need is to see the judge see you walk.
Yeah, no, absolutely. I mean, and I agree with that. Sometimes it's like, just telling someone or reading a transcript is not going to give them that information. You really need to.